Jesse, these are some of the devices I use for neck and upper back pain. This one I like better than anything that I've ever tried.
Okay.
This one has a little divot cut in it, which isn't really necessary. And I'm going to just cut it down and remove that. Maybe it's the nuchal ligament that they're trying to avoid pressing on, but there's no reason not to do that. So anyway, the one I sent you is my favorite because it's flat all the way across. And I just lay on it. This is about a ½ inch wide on the top. So I just lay on my back on the floor, right up to the occiput. You can even do it on the occiput, and that's very effective. Of course, there is muscle over the occiput, and then I just go all the way down a ½ inch at a time, and I go all the way down to the lower part of my shoulder blades, and I just, move my head and upper back to find the sweetest angle that gives me a release. When I store stress, it's just deeply held. I have very dense connective tissue. And so for me, I need a long, slow release. You might have freer connective tissue, and it might not be as helpful to you as it is for me because your issue might be more muscular than muscle and joint. Okay, so there's that. If I ever remake it, I'm just going to use a wider base just to make it more stable when I turn. It tends to move around a bit. All right. So there are other devices, and I I think I sent a picture of these. And these I found at a website called OTPT. And you can also look at websites like Massage Warehouse to find different tools. Okay? This is my second favorite. Okay? What's nice about this one, and it does have a matching ball that I've misplaced somewhere, is that you can adjust where you put it. So when I put these out here, my goal is to treat my rib cage, to treat all of my ribs. The number one rib is a little bit closer to the spine. So if I were to treat the first rib, I would bring these closer together like that. Okay? And the first rib is found when you pinch the upper trap, just the thickest part of the muscle. You'll be able to feel that, yes, my thumbs and fingers could ultimately touch each other if I could just melt that muscle. Well, the first rib is immediately beneath that point, and it's a distinct tubercle, so quite easy to find. And so I would put these balls at whatever setting allows me to catch those. Okay? And I favor laying on that for about 2 minutes. And of course, you search for the right angle with your upper back and neck. And then for the other ribs, it's a little bit wider. So I would tend to use more like that for me, and actually even that. And then that should get ribs 2 all the way down to about number 6. 7 and 8 and below tend to typically behave well, except that 12 can get compressed into the spine. And for that, I just reach around with my hand, find that tender rib, and I just pull it outward. So I pull, probably a 30-degree angle for a couple of minutes. Alrighty? I have a YouTube video on some really nice upper cervical exercises. And what amazes me is that given the anatomy of the upper 2 joints is so very unique, very different from mid and lower cervical, why do they show you the same old bend your head sideways, look left, look right, look up, look down? I mean, that's just lame, because if that motion is restricted, it needs a very specific, isolated kind of exercise. And this is the device I show on that video. You just go to YouTube and look up Hesch upper cervical exercises, and you'll see this device called Dr. Reiter's. You can try mine the next time I see you. And if it's comfortable, great. If it isn't, don't get it. So anyway, hopefully I'll see you soon and you'll have an opportunity to try this. And it's the curved piece that goes under your neck. For my neck, it's very comfortable and works for me. But there are some people whose necks are just a different shape, whatever, and it doesn't work. So I hope that's helpful to you. One more comment. You certainly can put this up and down on the thoracic spine as well. Just, you know, move it at the upper thoracic and then the lower. And hopefully that will be helpful to the soft tissues as well. So I think that's all I got on the topic. Thank you very much.